Hi everybody. Today we're actually going to be talking about the role of vitamin D. You've got 99 problems. Well, vitamin D is a solution to a lot of these problems. And today, my name is Dr. Maggie Yu. I am a functional medicine physician. But I've been in practice for 20 years. The first 10 years of my practice as a family physician, and the last 10 years of my practice has been in functional medicine. So I was trained at UCLA, one of the best medical schools in the country, and first 10 years as a family practice, and then the last 10 years as a functional medicine physician. I pride on myself on asking different questions, providing different tools, and therefore creating totally different outcomes for my patients. I did this for myself about 12 years ago when I actually went into early menopause because I had an autoimmune disease that no one could figure out, and I had to go on that journey myself. And I pride myself in the fact that once I have experienced what functional medicine is and being able to get different outcomes for myself so rapidly, I want to do this quicker, better, faster for my patients. So that's what functional medicine is about. So wherever you're watching from, I would love it if you could tell me where you are. I get a sense of the demographics even afterwards, and delayed when people watch it later, they tell me where they're watching from. It's great to see people from England, from San Diego, all, different places. Some of these videos are getting over 1,000 views within the first 24 hours. So please share, tag people that you think could benefit from these videos, and share this with your groups. Today we're talking about, hi Seaside, hi Melody. Today, we're actually going to be talking about vitamin D. It's huge. It's a big issue. And that's why I say 99 problems, vitamin D is here to solve it in a lot of ways. But there are some pitfalls associated with it that I want to discuss. So if you're enjoying these video series, please give me a thumbs up. Give me a heart. Give me a wow face. Thank you so much. Olaf from Milwaukee, thank you. Oh, Beaverton, thank you. And right now, if you haven't liked my page, please like my page, receive notifications so that you know when I'm on, what the topic is for watching live or watching later. If you already have a question about vitamin D, fat-soluble vitamins, or the role of fat in the diet, go ahead and start putting that in the comment section. If I have time, I could answer some of those, or I could pull in our functional nutritionist extraordinaire, Frankie Naiwat, to come back in and answer some of these questions. So I'm going to start delivering on some value right away on what vitamin D is, why it's such a big deal, okay? So first of all, hi Astoria, vitamin D is a hormone. It's not just a vitamin, it is a hormone. So what that means is every cell on your body has a vitamin D receptor, okay? So think about that. That means your brain cells making brain hormones is actually needing vitamin D for it to function properly. Your thyroid, okay, it makes thyroid hormones, requires vitamin D to function properly. And ovaries, ovarian hormones, we're talking about ovarian hormone problems or male testosterone problems. How many times have I seen that it's related with a lack of vitamin D? I would say 90% of my patients, no, scratch that, probably 100% of my patients that have hormone imbalances, vitamin D is an issue. So for me, right away when I see a patient, even before the vitamin D levels come back, I'm already looking and I'm saying, at least living in Oregon right now, you should be at least on 5,000 IUs of vitamin D3 immediately while we're waiting for some of these results. Now, there are all these things that you hear like, there are a lot of even MDs out there who really are sitting here saying, oh, you don't need to take additional vitamin D, or 5,000 is too much, or they don't test vitamin D. So I want to answer all that and give you guys a rational approach about vitamin D, and I want you to understand why it's so crucial. So first of all, vitamin D is a vitamin that is made on your skin. So your skin has enzymes and biochemistry process that takes the sun and then it activates vitamin D to become active vitamin D in your body. How much you activate vitamin D is dependent on two things. First of all, it's depending on how much sun you get. So these days with sunscreen, living in Portland, Oregon, living in Iceland, you may not be getting enough sun, and even when you do, you may have sunscreen on you. So that you may not be activating enough vitamin D. The other part of it is genetic. So there are peoples of certain tribes where traditionally they lived in areas where they didn't need as much vitamin D. So for generations and thousands of years, people living along the equator, okay, African Americans, Asians, Hispanic background may not, they have not needed much vitamin D because they lived along the equator, right? But put that person in Portland, Oregon, i.e. me, guess what happens is your vitamin D really plummets because I'm no longer receiving that much sun, and therefore my body, my genetics, my ancestors haven't needed that active enzyme much. So I'm not going to be able to make that, make much vitamin D. So Asian population living in Portland, Oregon, typically the vitamin D is really, really low, same with African Americans. Now, there's also certain Caucasian background where it's Norwegian, Dutch, Swedish, Scottish, Irish can sometimes have very low vitamin D as well, and that's just a genetic issue with people in that particular tribe or background where they just don't make much vitamin D. So my thing is that I definitely will listen to, I'll look at people's genetic background, but key is you gotta check people's vitamin D. But I have a big issue with this because the problem is that insurance companies are not allowing doctors like us to check for vitamin D. They allow us to check it, but they're gonna charge you probably $70 to $100 for the lab. And I think they just won't cover it. And this is a huge thing for me because I think there are a lot of lab tests that people need that are crucial, but insurance will just, say, oh, it's not needed to test vitamin D. And there's tons of data out on why vitamin D levels are really important to check, okay? And they just say, oh, we're not gonna pay for that. You can order it, we're just not gonna pay for it. My challenge and battle cry for you guys, which is what I did for myself, is do not let insurance determine for you what tests you need or don't need. You freaking need a vitamin D level check it, okay? And why is because so many different symptoms are associated with vitamin D deficiency. Now imagine, for example, vitamin D is a fat-soluble vitamin, so it absorbs through your gut, and it goes to activate a lot of different cells in your body. So it has a huge role in depression, anxiety, ADD, focus issues, okay? So people with seasonal affective disorder, thanks for the wow face, more, anybody, love it, great, thank you. Anybody with seasonal affective disorder over the winter, think about that, okay? One of the major mechanisms of that is that the decreased sunshine in the wintertime causes less activation of vitamin D in your on your body, so your vitamin D plummets. Vitamin D receptor on your brain that turns on your brain hormone production of beneficial brain hormones like dopamine, serotonin, norepinephrine, epinephrine goes down. So there is a mechanism for why people get seasonal affective disorder. One of the major ones is actually because vitamin D deficiency gets worse and worse as sunlight goes down in winter. So most importantly is that if you don't know what your levels are at and you're not taking any, is that this is preventable cause of major mental health disorder in the wintertime. So, if you yourself have experienced this and have taken vitamin D and have prevented seasonal affective disorder by taking vitamin D, say yes, me too. Because the fact of the matter is this happens literally every day in my practice. There's 2 or 3 people I see every day that has seasonal affective disorder, especially in this part of the country, and it's because they're not taking adequate amounts of vitamin D. So vitamin D can affect brain hormones. The other parts is it can affect your thyroid, which can affect your metabolism. It can affect your ovarian or testicular hormone production, then it affects your periods, PMS, moods, okay? Vitamin D is also a really important vitamin in your immune system, okay? So vitamin D is actually there to help activate your immune system to help you fight germs, okay? So if you think about it, why do people get sick a lot? People say, I get sick a lot in winter, I get colds a lot. And one of the reasons is they have really low vitamin D levels, right? The other aspect of this is that vitamin D, as far as acne, skin changes, right? In teenagers, I have tons of teenagers coming to me for acne issues. No one's ever checked them on vitamin D and nobody's ever given them vitamin D. But what is acne is a bacterial infection on your skin, okay? And what do you need to actually fight that? What do doctors prescribe? Antibiotics to kill germs, right? To kill bacteria. Well, why are we not checking vitamin D's or starting some vitamin D in our teenagers before we start prescribing them oral antibiotics for the rest of the next 2 years of their life, right? Thanks, Sam. Vitamin D is great, okay? So the issue with vitamin D is that it is a fat-soluble vitamin. So as far as dietary sources of vitamin D, there aren't that many, because if you look at it, there's some vitamin D in some fish like salmon, cod, sardines, okay, and egg yolks, okay? And the number in those foods are still really relatively low. So the amount that you actually need, sometimes, I mean, if you want to take a 5,000 capsule one a day and you want to eat enough salmon to make 5,000 IU, you're going to be eating like 2-3 pounds of salmon a day, which we're not going to be doing. So it's important to get those levels checked, okay? So what are some optimal levels of vitamin D? I would say that vitamin D level, unfortunately, a lot of physicians and labs will list a value of like 30 to 100 as normal. I want to point out something here, is that people misunderstand what lab ranges are, period. A lot of doctors and patients think that that range next to your lab as the quote unquote what they call the normal range is what should be ideal in a human being. That isn't. What numbers are there is actually the median 50% at that lab. Okay, so what's the average? So if you're in Switzerland or you're in Africa, that number range could be very different between one lab to another. So what I'm talking about is functional ranges of vitamin D level that's optimal for all these things to function. Okay, so and why not customize it, get your number so you know exactly how much to take. So ideal levels is 50 to 80, and that is true for kids and for adults. And I'm going to also show that in autoimmune disease specifically, vitamin D has been shown to calm the autoimmune attack in you to actually help your body function better. So it's one of the major cornerstones of what I call the autoimmune disease hack is getting your vitamin D level to 80. It's got to be at 80. And the data is damning, and it's there that when you have vitamin D level in 80 range, studies have actually shown in multiple sclerosis, in lupus, in diabetes. Yes, diabetes is an autoimmune disease. All the data numbers go better and better as you get vitamin D to 80. Okay, so the most important thing is get your vitamin D levels checked. Make sure it's between 50 to 80, and if it's not, you got to supplement. How much is dependent upon the person. I typically will say that, you know, in order to raise somebody 20 or 30 points, it's going to take about 5,000. So if you're at 10, okay, vitamin D of 10, okay, taking 5,000 might bring you up to like, 40. And if you have an autoimmune disease and you're trying to hit 80, you're going to be closer to like 10,000. Yes, thanks, Karen. I got you to 70, and you're on your way to 80, and great. And you can even go. I mean, if you're willing, anyone willing to share. When I've gotten people with autoimmune disease, or I've gotten people to where their ideal ranges are, what has improved for you? So I'm going to give you an example. I have a 9-year-old child that I saw who was constantly with tics, right? Constantly, like his whole body, face was twitching. It was interfering with school. He's seen a multitude of doctors and finally saw me. Wasn't even for the tics. It was for a lot of other things. No one has checked a vitamin D level. And so I checked a vitamin D level. This child was about 10. Okay, we started him on about 5,000 supplementation. He is a child, and vitamin D is a fat-soluble vitamin, so it accumulates in your fat. So whatever you don't, so it's not like water-soluble vitamins, whatever you don't use, it just pees out. So vitamin D can accumulate. So it's important that I look at kids to change the amount that I supplement for what their body weight is. So in him, I put him on 5,000 and got him up to about 75. And I saw him about 6 weeks later. The tics are gone. The tics are gone that this child has had his entire life. We're not talking small change here. This is a huge neurological change. That means that the brain cells are twitching and firing to cause these tics to happen, have calmed down because brain hormones are actually getting balanced because there's adequate levels of vitamin D. So vitamin D is not a small issue here. It's actually a major issue in many symptoms with kids and adults. Okay. So what the other part that I'm going to talk about is that as far as there was a question we were talking about, someone, Frankie, was it Karen's question?
It's about the dosages as far
So
as
school-age children, 7 years old, take vitamin D, and if so, at what dosage? Well, really, you need to check the levels. So I may recommend something to take while we're waiting for the lab, but I always check. It's really irresponsible, I think, to just blankly tell someone to take vitamin D and not check a level, or at some point recheck a level if you're giving someone really high levels of vitamin D. I've alluded to this, but what happens is that because these are fat-soluble vitamins, they accumulate in your fat tissue. So that's good and bad. So what it means is that whatever you're not utilizing, it gets stored in the fat. So over about 2 to 3 months, they can really build. So there is such a thing as vitamin D toxicity. So you can get too much. Yes, it solves 99 problems, but if you get it to 99 and above, over 100, 120, you can become vitamin D toxic. Okay, so I'm not one of those, everybody should be on 5,000, 10,000 vitamin D. I'm on the soapbox of everyone needs to get their freaking vitamin D level checked and know the exact amount that they should take. And if you're taking somewhere 5,000 or over, should about 2 to 3 months get it rechecked, regardless of whether your insurance pays for it or not. So that's something to think about with vitamin D. Now, one of the things that people have asked also about is, vitamin D absorption. So I'm going to talk about vitamin D because it's a fat-soluble vitamin. It needs to be absorbed in your gut. And if you've had gallbladder issues where your gallbladder has been removed, okay? If you've had issues with a lot of food intolerances and you are not absorbing well, sometimes people can take a lot of vitamin D and it still isn't getting absorbed. So it's not just what you eat, you are what you absorb. And so vitamin D absorption goes hand in hand with people who have, if you have issues with absorbing fat, you may need to have that identified by working with someone like me or a functional nutritionist. And there are testing to show that you have low bile salts, so low fat absorption. And sometimes giving a little bit of bile salts to the vitamin D helps with digestion of fat and absorption of fat, not just the vitamin D, but all the other healthy fats that we're doing. So if you've benefited from having vitamin D, please give me a thumbs up and a wow face right now. And another story that I have really briefly is a male with low testosterone around 350. I've mentioned that testosterone for males should be around 500 to 1,000. And this was a very symptomatic male at 350, thank you, that basically we tested vitamin D on, and the vitamin D level was about 25. He also was struggling with some depression and some anxiety. I didn't start this person on anything except vitamin D, okay? And then we rechecked testosterone about 8 weeks later. Vitamin D level became about 60. Depression, anxiety, gone. Acne is gone. He has had some psoriasis, flaking issues in his scalp, and that's really improving. And that's from daily taking the vitamin D. So there's a lot of unanticipated benefits that vitamin D can actually solve and resolve. Okay, so this is not a small issue. Vitamin D is a big issue. Get it tested. If you haven't liked my page and followed it to get notifications, please do that now, because there's going to be a lot of these hacks and secrets that I'm going through. I'm doing 30 days of Facebook Live. We're towards kind of halfway, a little bit past the halfway point. So there's tons of other topics that's coming up, and it's really driven by questions from you guys. So if you have additional questions on anything, you have comments about what we've talked about today, please feel free to post it in the comments section. I read them, I answer them. Please share it with people that you know. We're getting over 1,000 views, and thanks for sharing. What happens with toxicity? Teresa just asked. I saw a patient today where she was told, this is scary, okay? She was seeing either a naturopathic physician or another functional medicine physician in the area. She was told her vitamin D was low, and I looked at it, it was 28, and she was told to take 50,000 every day, okay? And she's done this for the last 2 months and never had it rechecked. That is an insane amount of vitamin D, okay? So she's complaining about having really severe leg cramps, okay? So because vitamin D can affect calcium absorption, okay? And so calcium utilization in your body. So what can happen is that people can get neurological symptoms. They can get seizures, you can get twitching as a result of too much vitamin D. You can actually leach vitamin D from your bones into the bloodstream, too much calcium. Some of these mineral imbalances can cause leg cramps, right? It can cause brain neurological changes like seizures, irritability, things like that. So this isn't a small thing. So the range is, I like checking the levels, and I can tell someone exactly how much to take. And I know from experience that, 5,000 is going to raise it a certain level in this size of a person. So it's one of those things where it's a lot of experience behind it. But it's actually crazy to me that someone would tell someone to take 50,000 IUs of vitamin D every day, and this person's taking it for the last 2 months, never followed up to recheck the level. So the first thing I did when I saw this patient as a new patient today was I said, we need to check your vitamin D now, and you need to stop the vitamin D you're currently taking, because toxicity can happen. So one of the things I really want to emphasize is that you are going to read a ton. There's a ton of stuff out there about which vitamin's good for you, bad for you. You're going to maybe sometimes see somebody who, well-meaning, will tell you to just take something because it's good for you. I'm here to tell you that what functional medicine is about and what I'm about is data-driven decisions about your health and what's really good for you, customized to you and your health conditions, so that you're not doing these broad brushstrokes that this person experienced. Vitamin D is good. Mine's low at 28. Oh, go ahead and take 50,000 every day for the next 2 months and let's not recheck it, right? That's not going to happen on my watch, and I don't recommend that. So there's pitfalls and perils with any sort of supplementation, just like medication. Okay, so great. Thank you so much. If you enjoyed this, please give me some thumbs up and follow and share and get notifications. Join my mail list because I'm actually going to be emailing out soon the autoimmune hack. I'm going to email that to all of you who are on my mailing list. So if you're not on my mailing list, go on the Facebook page where it says join my list and add your email to that list. So great. Thank you so much. And I'm going to see you guys tomorrow. And thank you for these questions. Keep them coming in the comments section. I do look at them and I do respond to them. Have a great day, guys. I'm Dr. Maggie Yu, and I'm your functional MD to the rescue. Thanks.